Hello, am I online? Awesome. Hi, everybody. Okay, so nice to be here. The name of my topic, keynote that I was invited to present here, and I'm really excited to be able to do it, is the 50-year diet, a patient's perspective on the trauma of weight loss and obesity treatment. So, full disclosure before we begin, despite Raheel giving me a medical degree or any kind of a doctoral degree, I am not a doctor. I'm not a researcher. I'm not a mental health professional or any other type of credentialed provider. I'm not a scientist. I'm not a researcher. I did like science in school, however. Um, what I am is I'm an expert in binge eating disorder and in obesity and weight loss treatments from the receiving end. And what I've learned is that these treatments, what they did for me was they increased my symptoms of binge eating. They affected my self-esteem in a very negative way. I found that I had deep shame, very, very crippled body insecurity, and pretty much did not like myself for a long time. And by the time I finally stopped long enough to be able to do some research and figure out that I wasn't just a really bad dieter, I actually had undiagnosed binge eating disorder. And that's what's made me come here today to talk to you about binge eating. And so, what I can tell you is that I dieted for 57 years by the time this was all done. And the idea of being able to live a life and look back and say, oh my gosh, I spent 50 years, more than 50 years on a diet, planning the next diet, going on a diet, falling off a diet, cheating on a diet. It's pretty, it hits you in an emotional way that's pretty profound. So really taking the time to figure out what binge eating disorder was changed my life. Now, I do now write about binge eating disorder. I do coach. I do talk with people all over the world about how binge eating disorder really is something that we don't want to stigmatize. We actually have the opportunity to look at it in a really powerful and healing way. When we lean into and accept and learn to really know who we are and why we've become binge eaters, there's a path to healing there that's pretty profound, and that's what I really want to talk to you about today. So, what are we trying to cure when we think about weight loss and obesity treatments? What I have found is that my weight is not what is sick in me. The fact that I'm overweight or was more overweight or skinnier than I am right now, those are symptoms outside my body. Binge eating disorder is something that happens from the outside in. We recognize that it's something that happens to us. It is not something that we're born with. My weight wasn't what was making me sick. So if we think about it in the context of obesity and weight loss treatments, what is it we're actually trying to cure? What I did discover is that I have a disorder that starts on the inside and shows up on the outside. So, just a little quick disclaimer here. First of all, of those of you in the room here, how many of you are on the treatment development side of the equation when it comes to obesity, weight loss, or even diabetes? You're working on treatments. Great. Okay, about maybe half the room. How many of you are on the service delivery side? You are delivering treatment. Okay. Is there anybody here who's doesn't see weight loss as the thing we're trying to deliver with those treatments or create with those treatments? Oh, that's cool. There's like four of you. That's awesome. 4 or 5. I missed you, madam. So why are we talking about it here? Well, it's because an estimated 40% of patients who seek weight loss and obesity treatments meet the diagnostic criteria for binge eating disorder. Up to 70% of the individuals with BED may also be obese, and individuals with this disorder are much more likely to be morbidly obese. So, frankly, this is your audience. We are your audience that you are designing treatments for or you are delivering treatments to. More than 57% of those diagnoses are in women, though the incidence in men is widely considered to be highly underreported. Matter of fact, I read an article like 3, 4 days ago in the Guardian newspaper about binge eating disorder developing in elite male athletes. And you think about it from the perspective of they're being told their livelihood, their athletic career, their financial stability is going to be disrupted if they don't meet weight requirements of their sport. Won't be allowed to play, they'll lose their contract, whatever. So it's really all over the place. It's a global phenomenon as well. We used to think that it was just this pesky little problem with Western cultures, Western countries. It's now increasing in incidence all over the world in non-Western cultures and in ethnic minorities. So BED is also the most common of all eating disorders, 47%. The rest is made up of bulimia, anorexia, pica, avoidant restrictive disorder, things of that nature. However, even though it's the most common disorder, it did not have the dignity of its own diagnoses in the Diagnostic and Statistical Manual of Mental Disorders until DSM-5 came out in 2013. I've always found this really curious because it's almost like, as I said, we did not get the dignity of a disorder. We were just fat. Fat. Lose the flippin' weight, okay? Get yourself together. And it's considered a moral problem, an ethical personality disorder, if you will, or personality problem. And so for me, for a number of years, I was not even properly diagnosed. You know, I just did not know what I had. And had I known many years earlier, there might have been an intervention that would have made a big difference before I went on 57 years of diets. And before I had my metabolism and my hormonal balances dysregulated, things of that nature. And unlike other eating disorders, it is very rare for a caregiver to offer a treatment to a patient who is fat. Very often, patients have to seek the treatment. They have to say, you know what, I'm these few extra pounds or this few 200 pounds that I have on, I'm really ready to deal with it now, whatever. And the doctor will prescribe some kind of course of treatment, or the mental health professional will prescribe some course of treatment for that. And again, it sort of puts what we are dealing with in a moral category. It's like, come on, if you would just get yourself together, you would not even have to ask for treatment. And so, true story, when I was seeing a psychotherapist a number of years ago, I actually asked for a referral to a general practitioner who understood what it was like to be in the body of a person who was really overweight and who could not control their eating. Again, I was not diagnosed at this point. So this was in the San Francisco Bay Area. A lot of great doctors there. My psychotherapist did a lot of work and found the name of a physician who everybody said, this is the guy you need to talk to. So I called the office, followed up. They let me know that he was not taking new patients, and they did recommend someone else. I did explain, now you know why I had this referral to this doctor, right? You know where this is going, okay, already? So I get to the appointment. There's a young physician there who has no clue what I am talking about, has no clue why I'm there, does not get why I would want any kind of special care or attention for my obesity because I am out of control around food. Just doesn't even really get it. Did not really address the metabolic disorders or the dysregulation of hormones that occurs from a lot of yo-yo dieting, whatever. And I don't know, maybe I did get a little emotional because there is so much shame around going in and asking for help when you are overweight. There's this sense that we're going to be judged, we're going to be dismissed and told once again, just get your stuff together and go lose that weight. That he left the room. I must have looked like I was going to like strangle him with a stethoscope or something because he left the room. And he came back with another caregiver, I assume a supervisor of some sort, who offered me the psych referral. I remember I started with the psych referral. So very, very clear that there is a general energy around this disorder that doesn't recognize it, doesn't see it as a legitimate disorder that requires treatment in a different kind of way. How do we become binge eaters? I said this before, nobody is born with binge eating disorder. It happens to us. Most frequent onset is in late teens through the 20s. However, it can happen at any age. My earliest memory of binge eating is preschool, actually. I would pull a chair up to the kitchen cupboards because I was too small to reach them, climb on the counter and raid my mother's baking supplies in the middle of the morning, like 2, 3 in the morning, and eat lumps of brown sugar and chocolate, baking chocolate, whatever. I've worked with people that have had onset in their 60s due to a traumatic life event, and a woman in her 30s, late 30s, who in response to a sexual assault. So it can happen. The thing that ties it all together for us is that there is some kind of a traumatic insecurity that occurs at a time when our brain is actually very disposed to use the comfort that comes from high energy foods, usually highly processed foods, to create a sense of soothing and comfort and care. There is a mix of genetic and environmental and social and psychological factors. It can be generational. You can see your mom dieting. You can see all this kind of stuff. But there are stressors that trigger it. And that's where I get to that traumatic insecurity. This sense of you are in stress or you are in trauma long enough for a long enough period of time in the presence of foods that then stimulate that mesolimbic dopamine system, that reward center in our brain, and we get a very quick sense of relief and comfort from that. And so we become traumatically dysregulated. Our brain starts to rely on that to provide comfort and care for us in times of upset. And it can go on for the rest of our lives. Maybe that was a Freudian slip. Anyway, we can go on for a long time without a lot of good care unless we're diagnosed. So that's me, 9 years old, traumatically dysregulated. Now my body doesn't know how to regulate itself correctly. My emotional and psychological mindset can't regulate itself, and I'm always a little off on a wrong foot. And so I'm very susceptible to seeing these high energy foods that my brain gives me a reward off of as something that will help me feel safe and secure. So traumatic dysregulation, what does that really mean? It's what I just described, that binging creates these temporary feelings of safety and security. It helps me feel like I am regulated. And it's not just the sensation in our brain, that reward center, guys. It is also the sensation, the repetitive action of eating. I don't know, you know about kind of treatment for some autistic children or deeply, deeply autistic children, that there is a touch therapy that is about regulating. I'm going to regulate your physical body, and our whole mechanism starts to calm down. And it is part of that sensation of eating over and over again. There's also a heaviness in us that we get. We talk about we're overfull, all that kind of stuff, but the heaviness that we get is kind of part of that comforting and care that we need. We have developed a way to regulate ourselves by stuffing, just feeling that weight in our body. I know at times in my life where I've been very, very thin, I talk to people about feeling like I'm going to fly out of my own body. I'm just going to, I have nothing to hold me here. So binge eating disorder, very often there's weight gain with that. We're eating a lot of calories in an effort to regulate ourselves, and so we put on weight. And what happens is that creates body insecurity. In the world we live in, it is considered very bad to be overweight. There's almost nothing that is worse than being overweight. And so that reinforces that traumatic response. Now we're like, the thing that we're doing to help regulate ourselves is causing us even more pain and trauma. So the thing that is really awful, however, is that there's a transference of this sense of I'm going to gain safety by regulating with food. We transfer it to I'm going to gain safety by controlling my appearance. I'm now going to focus on getting this body into shape. I am going to manage if I lose weight, I will be regulated. I will have no pain. I'll be happy. I'll drive a big car. I'll make more money. I'll grow 4 inches, whatever. Those are the kind of fantastic and magical things that we think about in terms of our weight. And so we go into it again and again and again. We get weight cycling. So I think it's really time to learn what you're dealing with here as treatment providers, as service providers, etc. Now, a lot of people could just look at this picture. I'm going to tell you, I'm getting a little triggered looking at this. Donuts, Krispy Kremes. Um, a lot of people can eat a donut and it provides a sense of pleasure, but it is that mechanism of dysregulation in us and this habitual, now we're hardwired. Our brain just goes boing, go, I have a sense of pleasure. I'm ready to go. I need more of this. And I must tell you that when we remove this resource of how to regulate and comfort and care for ourselves, we set off a cascade of anxiety in us. I cannot understate this. In some cases, if the use disorder of food to regulate is very severe, it will feel like our lives are at stake. Our survival depends on getting back in regulation, and we will do anything about that. We experience this, it's typically called a craving. I've learned to call it this terrible, deep sense of mouth hunger. That's how we experience it. It literally, and I have some people that talk about feeling it physically in a different way. I personally feel it around my mouth and here in my throat. It is different from body hunger, which is this normal relationship that our body has to food. It's like I need some energy, I need to move forward, I need to eat right now. When you have mouth hunger, I must eat or I will die. And again, I am not understating that. This is not something that we're just making up in our head as an excuse to keep eating. And so historically, we see obesity. I've mentioned this before. I can't read my own notes there. We see it as a moral failing. It's we see extra weight on the body as that sign of a moral failure, flawed character, lazy personal ethic, whatever. And that's why everybody gets so flippin' excited when there's a weight loss success story. It's, a lot of commercial weight loss programs love to slap these all over the television or magazines or wherever and show us these success stories from weight loss. And you know what? Diets work. They absolutely, if you follow them, you're going to lose weight. The thing you don't see at the bottom is the results not typical, that very small print at the bottom. Results not typical. I will tell you something. I have been one of these success stories several times. I have a million pictures I can throw up here. Well, maybe not a million, but many. Different times in my life, different sizes, back and forth, the befores and the afters. I could show them to you and show you that, yeah, diets work. This picture here on the right is me after my last diet, actually, excuse me, on my last diet. And it was very expensive. It was a holistic nutritional program. There was a lot of blood testing. There was a lot of urine testing, on a weekly basis. It was very pricey. Worked, totally worked. What didn't work was I still had the same brain and the same reasons to regulate myself that I did before I lost weight. It didn't take my pain away. It did not help me somehow resolve the traumatic issues that would trigger me to experience mouth hunger. That mouth hunger was screaming all the time. And the day that this diet was completed and I was, announced you are in the maintenance phase. There's a great podcast, by the way, called Maintenance Phase that it kind of talks about this whole topic of do diets really work? The day that I was declared to be in maintenance, I started eating pies. And so, again, the thing I didn't lose with all that weight over and over and over again was my brain and how my brain responded to dysregulation. And the shame when you are a serial dieter now, you're a yo-yo dieter, you're a weight cycler, all that kind of stuff, is just dreadful because everybody can see what a screw up you are. Everybody knows why you're, oh my God, she's fat again. Oh my God, she's skinny again. Now she's fat again. That's just the humiliation of that is pretty profound. So this yo-yo cycle, it's this idea that God darn it, I'm gonna control this body. And it's this body that gives me pain. I'm focused on this weight. This body is what gives me pain. I'm gonna go on a diet. But it's this belief that our weight loss will relieve this insecurity that we have, this kind of chronic dysregulation. And you know what? It's not true, but we're going to try it again because God darn it, there's just no one, we've not been given any other options. Our logic doesn't work, however, and we have very little control because as soon as we remove our regulating resources, that thing our brain is reliant upon, mouth hunger kicks in and it is irresistible. I mean, we can white knuckle our way through it a bit, but the fact is willpower is not infinite. It's finite. You get tired and whatever, it goes away. And as our trauma piles up, we don't learn how to manage our weight in a different way. We just are holding it together. And that terrible, profound shame when we go round and round and round. And here's the truth, and I believe this, that if I had stopped dieting in my 20s, I don't believe I would have the metabolic issues that I have. I don't believe I would have the whacked up hormones, in terms of appetite and hunger and fat storage and all that crap that I now have. I'm now very likely and predisposed to carry more weight on my body now. I just am because I went through all of that. And you know what, guys? It's the same if we're pursuing drugs and surgical treatments. Weight regain is very likely once any kind of weight loss drug. Obviously, the most popular one now is the semaglutides, the Ozempic and the Wegovy and the Monroe, blah, 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 blah. When those medications are done, the weight returns, the mouth hunger returns, because again, I have the same brain. I just interrupted it and hid it from myself for a while. And patients who undergo surgical procedures, the lap band, the gastric sleeve, etc., these are patients that have to implement dietary restrictions for the rest of their life to be able to maintain that weight loss. It's not a magic bullet. It still requires us, it comes back to the very same thing. The question is, can we maintain diet? Can we stay on a diet? And I will tell you that left on our own without addressing the dysregulation that drives binge eating disorder, the answer is no. So if you're out there looking at new treatment options or designing treatment modalities, that the core of the treatment plan is lose weight, restrict, do something, it's going to fail. It's just not going to happen. It's not going to work. So the other thing that I want to talk about is a lot of people, and I've had this said to me, obesity and having extra weight on your body is just not healthy. And I'm not here to argue that because I think there is medical data that obesity is a marker for a lot of health issues. I'm really not here to argue that. I'm here to say that offering weight loss as the cure all, despite years of it failing and not working and making people sicker and sicker, is just as detrimental. So this is a picture of my brother. This is Mike, my oldest brother. He just before he died, actually. He was 47, and Mike was chronically, he was an overweight kid, he was an obese teenager, and he was a morbidly obese adult. And he lived his life on a series of diets. And this was back when you took amphetamines, they were prescribed to use to lose weight. All of the diet food products were laced with saccharin and all this kind of crap that we know now is very, very bad for us. But the big thing is he was about 10 years older than me, but I remember there was something about him that was poor Mike. He was so disheartened. He lived in shame and he was marginalized. Look at him we're at a family event here. He's standing behind the fence, kind of hiding himself. And that was his life for as long as he lived. Now, he died of leukemia, but I believe that a lifetime of weight stigma, binging, and restricting, and the related disorders or metabolic dysregulation of hormones and all the things that come when we're serial dieters is what really killed him. That and the terrible shame, just the terrible shame of it. So is the pursuit of weight loss worth it? Well, I don't think so. And I think if we really look clearly at the science around this, we can see that there's all kinds of things that get screwed up when we go on diets. There's weight cycling. It results from, we can decrease our resting metabolic rate and increase our fat storage. We know that the fluctuations in weight are linked to an increase in these chronic conditions that we typically associate obesity with. Excuse me. A little dry air from the airplane, I think. Um, we know as yo-yo dieters, we're likely to end up at a higher overall body weight over time. These hormone levels get all disrupted from repeated dieting, including those related to hunger and appetite control, and it affects our ability to maintain a healthy weight. Let's say even now, I have difficulty maintaining a healthy weight, whatever healthy is in this context. Interestingly, I just read an article from an Australian study, a team that looked at a group of patients that were overweight. I don't think they called them obese, but it's different cultures. So they were overweight, and they tested them pre-diet to get levels on various hormones related to appetite suppression and fat storage and hunger. And then they went on a diet, and then they followed up 1 year later. In those tests 1 year later, they found that a tremendous amount of abnormality in the hormones that regulate appetite, fat storage, and other things. And I need to look at my notes on this one. Excuse me. It was related to leptin, that hormone that tells us, almost there, the hormone that tells us that, hey, you've eaten enough, you've stored enough fat, etc. That hormone, here we go, was lower than normal. Ghrelin, that hunger hormone, was about 20% higher, and peptide YY, a hormone associated with hunger suppression, was abnormally low. Plus, the patients, this is 1 year out, about 30% had started to regain their weight, which we know eventually, very high percentage of them will get it all back eventually. And they reported being hungrier and more obsessed with food than they were prior to the diet that they'd gone on. Oh, I love this one. Weight loss failures can lead to loss of motivation and difficulty adhering to healthy eating plans. And we've talked about why. Because we continue to focus on our body as the problem, our weight is the problem. And we keep trying to cure that over and over again. And so when our brain stays the same and we don't understand that we're dysregulated at a very deep level for a lot of reasons, uh, none of that sticks. And obviously it affects our mental health. I talked about the great shame, et cetera, et cetera. But I love this last one. It can also lead to eating disorders. So I had a conversation with a potential client. She didn't actually go on and continue to work with me, but we did a Zoom meeting together. Young woman, brilliant woman, beautiful. And she described to me that she had had her food restricted from a very young age for health reasons. Her mother was a physician, actually. And so she'd had so-called bad foods restricted from a very young age. She had been on and off diets and had lost tremendous amounts of weight during her life, including a variety of treatment modalities, including an inpatient program for medically supervised dieting along with behavior modification therapy. And she had just recently come out of that because she couldn't afford it anymore. The weight was coming back. And then the final kind of kick in the gut was she had been diagnosed with type 2 diabetes. She was about 28, 29 years old when I talked with her. And I had said she was very brilliant. I was talking to her about my philosophy, about, what I think the real issue is. And every book I mentioned or article, research study I mentioned, she had read it, she knew what it was, and she debunked it. She had said, no, well, I've heard this, but I don't think that, and no, 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 no. She argued with really everything. And so in the coaching environment, I didn't quite know what to do. I didn't know how to help her. And so I asked her that, why are you here? You obviously are very well informed. What do you want from me? And she looked at me via Zoom and she said, I want to find the thing that works. I don't want to try anything else until you can tell me this is the thing that works. Man, I totally got that. The madness of what repeat and serial dieting and weight loss, pursuit of weight loss as a goal does to us mentally, emotionally, and physically, and trying to dissect it all and understand it all and find our own path forward, it is maddening. It is maddening. So I want to share something with you, which is why we come to you to seek treatment. First of all, we're going to be embarrassed that we even showed up. We're going to feel judged by you because we're overweight and we need help with an issue that everybody tells us we should just be able to fix if we had a stronger backbone or a, more direct moral compass. And while it sounds like we're going to ask you for help losing weight, that we're going to look for an obesity treatment from you, what we're really asking for is something quite profound and different. We're asking you to help us understand and feel loved. We're asking you to look inside us and say, please make me normal. Please make me look like everyone else. Please take away my shame. However, our disorder also doesn't make that possible until we lose weight. Chronic dysregulation and the solution for it to our bodies. Hell darn it, if I could just lose this weight, all this pain and confusion is going to go away. My brain is going to be changed one of these doggone times. So we've got a paradox here in terms of obesity and weight loss treatment, and that is that patients with binge eating disorder who pursue these treatments, we are predisposed by our disorder to fail. The statistics on this are enormous. 97% in some studies are failure rates for all of these modalities of obesity and weight loss treatments. And so the only successful strategy I'm proposing is to remove weight loss as the goal of all treatment solutions. Weight loss should not be the thing we are trying to cure. It should not be the thing we are trying to control when these patients come to us seeking treatment. I know that sounds crazy, but I believe it is time to think about healing from the inside out. And tomorrow's treatment modalities, we have to take that approach. We have to look at this patient from every perspective. And I'm being serious about this. We need to learn how to heal a broken heart. If we really want to eradicate obesity and take it off the planet and the supposed health detriment of that, again, I think that's arguable. I sort of feel like there's something about just being fat and happy and loving who you are right now. But we've got to learn how to heal what really ails us. And it is not our weight that is making us sick. Okay. So I'm going to challenge you. Can we design the gastric band equivalent to patch a hole in a soul? Can we come up with a drug that goes back and helps us see and manage the trauma of a childhood that created that chronic traumatic insecurity and that chronic dysregulation? Can we do that? You know what? It's the time for this to change is really now. And here's why. Obviously, everything we've done right up to the most recent obesity treatments of semaglutide, the Ozempics and the Wegovy, we are just treating the same symptom over and over and over and over again, and it is not the right one. Can we shift this paradigm of treatment design to something completely and radically different? I think the opportunity is huge. So it is this whole health approach to clinical design. I think there is a place for surgical and drug interventions. I really, really do. I also think there is a place for behavioral and modification therapies and strategies and emotional and and mental support systems. You could even argue there's a socioeconomic factor that needs to be brought into this. Food insecurity, poverty, marginalization, chronic trauma in an environment. If I'm living in a war zone, I think a bag of Krispy Kreme sounds pretty good. The trick is we've got to get everybody in the same place at the same time and focused on the same issue. We are not designing treatments to lose weight, to meet that very shallow, if you think about it, and diet culture driven requirement. We have to think about what are we trying to cure, and can we do it in this group clinical setting, and can we shift everybody's thinking to this new paradigm? Now, let's imagine how would we take that forward if we did it? First of all, these teams, when you bring them together, they need to be educated. They need to hear what I've told you. They need to see the statistics that make it clear that continued pursuit of weight loss is detrimental to health. It does not help us in the long run. It makes it work worse for us. We become more ill. They need to know what they're dealing with. They need to know that there's just some things that you can say, hey, this is a solution that we are never going to be able to work with. And we need to address fat bias in the clinical and care environment. It is just out there. There is this belief that, God darn it, you just need to lose weight. And there's also the belief that being obese is the worst thing you could ever be, that any kind of health detriment that might come from the treatment is worth it because, of course, it's terrible to be overweight. That is just faulty thinking and has got to be addressed. And then we need to bring those mental health experts into the design team. And I'm talking about design, planning, and not just delivery. And it would be great if it's somebody who is a specialist in binge eating disorder treatment, but somebody who culturally understands and from the physical, emotional, and spiritual perspective, what it is you're really trying to cure. And I'm talking about bringing them in, again, in the design phase, not in just the delivery planning phase. Don't bring them in for an afternoon and say, hey, here's what we've got in mind here. What do you think? They can help you understand, again, what is a patient actually capable of following through on? So a final word here. And again, it's just been a thrill to talk to you guys today and share this kind of feeling about where we can take weight loss and obesity treatments in the future. The market, if you want to look at it in economic terms and that kind of crass terms, is huge. It's global. And nobody's cured this yet. It is still out there. And the opportunity to provide relief for the curse of an eating disorder, the curse of an obesity epidemic, whatever that is, the effect on our society and being able to re-enfranchise a whole large swath of our citizenry across the globe is phenomenal. This is really could be the thing that changes the world. This kind of whole patient-centered approach to understand why we are fat and why we use food to keep ourselves well in a very misguided and maladaptive attempt. When we understand that and bring obesity and weight loss treatment to that, well, it could be phenomenal. And I challenge you to be there, to be the one and have the courage to take us there. I'm so excited to see what you come up with. One more thing. Don't put us on a diet. Thank you, everybody. Thank you very much.